Hi, my name is Dikeledi Waramkhobe. I'm a communicator in Petersburg Hospital. August is an organ donor awareness month. Did you know that there are thousands of patients out there who are suffering from severe organ illnesses and are awaiting for someone to donate? In Petersburg Hospital today, I'm with a nephrologist who is attached to renal units, and we are going to talk about organ donation awareness. Greetings, doctor.
Greetings, Dikeledi.
And how are you?
I'm well, thank you.
Can you briefly introduce yourself and tell us what you do in the hospital?
Okay, so my name is Dr. Phetho Mangena. I'm the head of medicine at Petersburg Hospital. I'm also a nephrologist and I work in the dialysis unit with patients who are waiting for kidney transplant, and I also treat patients who have already received a kidney transplant.
Doctor, what is the current situation in renal unit and in the province as a whole?
So Polokwane has 250 patients who are on dialysis, and all of these patients are awaiting kidney transplant. In addition, we have 20 patients who have received kidney transplants in the previous years that we look after.
Talking about organ donation and organ transplant, who can become an organ donor?
So there are two kinds of donors, Dikeledi. The first kind of donor is what we refer to as a deceased donor. This is someone whose organs are donated to patients after they've passed away. The second type of donor is called a living donor, and this is when someone who is alive undergoes an operation and then a kidney or a portion of their liver can be surgically removed and then transplanted to someone who has kidney failure or a patient who has got liver failure.
Do I have to pay to become a donor?
No, you do not pay at all. All the costs of the operation and the cost of the tests that need to be done before the operation will be carried by the state. And in addition, a person who has donated an organ will receive free healthcare from the state for life.
Sounds very interesting. But then how much does one pay to get an organ?
Once again, one does not pay. It is actually illegal to buy organs. Those who donate do so from the goodness of their heart, and it is done as a voluntary act and as a gift to society.
So what are actual organs that need to be donated? And again, I heard that you can also donate a tissue.
So some of the organs that can be donated include the lungs, the heart, the liver, kidneys, and the pancreas. And then the tissues that can be donated include the cornea as well as cartilage.
A person who's still alive, how many organs can they donate?
So whilst one is still alive, one can only donate one of the kidneys or a portion of the liver.
And then after death?
A deceased donor can donate both lungs, both kidneys, the liver, the heart, and the pancreas. So this actually means that a single donor can save as many as 7 different lives.
Dr. Mangena, what happens to me after donating while still alive?
Well, firstly, before the operation to retrieve the organs, we undertake a lot of investigations to make sure that the donor is healthy and will be able to have a healthy life after transplant. Donors are able to have a completely normal life after donating, which means they can still have children, they can still work, and they can still play sports.
What is the process of retrieving organs from someone who has passed on?
So when we have a deceased donor, a transplant coordinator will come to speak to the family. The transplant coordinator will explain the process of retrieving the organs, and after the family gives consent, we are then able to surgically remove the organs that will be used to save these 7 lives. Afterwards, the body is returned to the family for burial.
If one is interested to become a donor, how do they register?
So if one wants more information and wants to register to become a donor, one can go to the website for the Organ Donor Foundation. Their website is www.odf.org.za. Alternatively, you can also phone the Organ Donor Foundation, and their toll-free number is 0800 22 66 11.
What is your parting message as you conclude?
So organ transplantation really is the gift of life. There are thousands of patients out there who are waiting for an organ transplant. So my message is for all citizens to consider becoming a donor and also speaking to their families so that they know their wishes.
Thank you, Doctor. We really appreciate it and we think it was very informative.
It was my pleasure.
As you heard, an organ is a gift of life. Come on, come on, let's register to donate our organs. Thank you. Hashtag Let's Grow Limpopo Together.